Asthma is a chronic lung disease. It affects millions of people around the world. This disease makes it hard to breathe. Asthma can range from mild to severe. It can make it hard to do everyday activities. People with asthma have inflamed airways. This means the airways are swollen. They are also very sensitive. When something triggers asthma, the airways get narrower. This makes it hard for air to move in and out of the lungs. Common symptoms of asthma include wheezing, coughing, and shortness of breath. Wheezing is a whistling sound when you breathe. Coughing is often worse at night or early morning. Shortness of breath is when you feel like you can't get enough air. Asthma can be life-threatening if not managed properly. It's important to understand the causes, symptoms, and treatment options. With proper care, people with asthma can live full and active lives. Asthma is caused by a combination of factors. These include genetics and environmental factors. Genetics play a role, meaning asthma can run in families. If your parents have asthma, you're more likely to have it too. Environmental factors are also important. Exposure to allergens can trigger asthma. Allergens are things like pollen, dust mites, and pet dander. These things can irritate the airways. Other triggers include air pollution, smoke, and strong odors. Even exercise can be a trigger for some people. When you have asthma, your airways are very sensitive. They can react to things that don't bother other people. It is important to know your triggers. This can help you avoid them and prevent asthma attacks. Talk to your doctor about getting tested for allergies. Diagnosing asthma involves a few steps. First, your doctor will ask about your symptoms. They will want to know how often you have them and how severe they are. They will also ask about your medical history and your family history. Next, your doctor will perform a physical exam. They will listen to your lungs and check your breathing. They may also order some tests. These tests can help measure how well your lungs are working. One common test is called spirometry. This test measures how much air you can breathe in and out. It also measures how fast you can breathe out. Your doctor may also order allergy tests to see what triggers your asthma. Treatment for asthma usually involves medication. There are two main types of asthma medication: quick relief and long-term control. Quick relief medications are used during an asthma attack. They help to open up the airways quickly. Long-term control medications are taken every day to prevent asthma attacks. Living with asthma means managing it proactively. This means taking steps to prevent asthma attacks. One important step is to avoid your triggers. If you know that pollen bothers you, stay inside on high pollen days. Another important step is to take your medication as prescribed. Don't skip doses, even if you are feeling well. Asthma medications work best when they are taken regularly. It is also important to have a written asthma action plan. This plan will outline what to do during an asthma attack. Make sure to discuss your plan with your doctor. Regular checkups are also crucial. Your doctor needs to monitor your asthma and make sure your treatment plan is still working for you. Remember, asthma is a manageable condition. By taking steps to manage your asthma, you can live a full and active life.